They were talking about Latrell Mitchell's Lisfranc injury. As reported by the NRL physio, he suffered a Lisfranc injury against the Eels over the weekend and is out of Origin 3. The NRL physio has reported that he'll be out for 4 weeks, but I suspect he'll be out for a lot longer than that, no matter which way it goes. Now, a Lisfranc injury is essentially an injury that disconnects your great toe side of the foot from the rest of the foot. So the great toe side is just marked in blue there, and it disconnects from the yellow side of the foot here, which is essentially the rest of your foot. And you can get arch collapse and in some cases arthritis if the injury is not treated. Even in patients that are treated, they can have up to a 15% rate of ongoing pain. Now, the thing that connects the two parts of the foot is the Lisfranc ligament, and it runs from a bone called the medial cuneiform, which is a square-shaped bone marked here, and then runs into a bone called the second metatarsal, which is in line with your second toe, but in the middle of the foot. And it is the single most important stabilizer of your arch. Now, the mechanism in terms of how you do this injury is you've got to have what's called a plantar flexed foot, meaning that your heel is up in the air and your toes are on the ground being flexed. And generally, there's got to be what's called an axial force place, so force placed downwards through your lower leg. And so NRL players typically injure it in a tackle. For the rest of us, it's usually falling downstairs or something like that. Now, a Lisfranc ligament injury, we're just going to draw that here. We're just basically going to draw the ligament essentially kind of sawn in half or snapped in half. Unfortunately means that the second metatarsal bone, so that bone that's in line with your second toe, can then move outwards and away from the great toe, and that is what often causes ongoing pain, reduced stability to the ankle, and sometimes a drop in the arch. Now, these are some x-rays showing the injury. The x-ray on the right is completely normal, and we're just going to mark here that the space between the two bones there, the second metatarsal and the first, is normal. Whereas on the left, the same space is widened, and that's marked by the yellow arrow just there with the red circle. And so what happens with these injuries is that the second metatarsal, which we're just going to mark out sort of a bit more clearly on the x-ray slowly, actually then moves away from the great toe, and that's what causes the injury. And it can be quite indolent in terms of it's often missed in up to 25% of cases. And like I said, if it's treated properly, in some cases, it still has a 15% rate of ongoing pain. So, for instance, Kalen Ponga's coming back, but he might have ongoing pain to that foot. Now, Latrell's likely to have an MRI if they've identified the injury. And on the MRI, they're looking to see if the ligament's intact. And we're just going to mark it for you here. In this MRI, it is intact. And sort of how bad that ligament is injured will ultimately determine whether he is likely to require surgery or not. And I understand that Latrell's due to see a specialist on Tuesday. So as we said, the big question is, does he need surgery? And the way the specialist is going to determine that is by how much of this ligament is injured. There is one component to the ligament which sits on the top part of your foot called the dorsal part of the ligament. So just like a dorsal fin on a dolphin or a shark, it sits on the top part of the foot. And it is the weakest part of that ligament. And if he's only done that, he'll get away with it and may not need an awful lot of time out. If he's injured the component of the ligament that's on the plantar or bottom side of your foot, on the sole side of your foot, it looks a little bit different. It has two little arms going to not only that medial cuneiform, but also to the second and third metatarsals, so bones in the middle of your foot, but in line with the second and third toes, and it is much stronger. So if he's injured that ligament, he's very likely to require surgery. So we're just going to draw this again. On the left side here is your dorsal one, so the weaker one on the top of your foot. In the middle here, we're going to draw the plantar one in blue. So this is the one on the underside of your foot, and it is the stronger one. If he's done this, he's in trouble. He's going to need surgery. But what I want you guys to try and imagine is looking at this area from the bottom, from the big toe downwards. This is going to be pretty confusing. But what it looks like here, the metatarsals are marked in red, and that cuneiform, the square-shaped bone, is marked in blue. And they're connected by ligaments or ropes. The plantar one is in blue on the bottom, and we're just going to mark out so a bit more clearly. So the blue arrow there is the cuneiform. We're going to mark out both of the metatarsals in red arrows here so you can see them more closely. Okay, and just imagine you're looking at them from the bottom down, and then they're going to be connected on the top by this dorsal ligament, so the second metatarsal and the cuneiform, and that's the weak one. So if he only goes through that, he'll get away with it and unlikely to require surgery. Be back soon, hopefully. If he goes to the bottom one, the plantar Lisfranc ligaments in blue, he's likely to require surgery. Or if he goes to that yellow one you can see there, he will likely require surgery. That's called the interosseous ligament. So that's going to determine whether he needs surgery or not. And it would have been the same for Kalen Ponga when he had the injury, and it's the same for Junior Paulo when they assess his injury. And likely in an NRL athlete, depending on how bad the injury is, he's likely to get something called a tightrope which is what this construct is here, which does the job of this the Lisfranc ligament while the body's scarring it up, essentially. But if you've enjoyed our video today, take a look at some of our other foot and ankle injury and NRL videos. Alternatively, you can subscribe to the Foot and Ankle Orthopedic Surgeon. Thank you so much for listening.